All right, guys, welcome back. This is Dr. Chris Carrubba here with TrueLearn, and today we're going to highlight some more test-taking skills that you can use to do well on the USMLE exam. Today, we're going to be looking at my test-taking process that I would use going through this question from our Step 2 and shelf bank. So, as always, I've said it before, I'll say it 1,000 times, I like starting with the last sentence first and looking at the answer choices that it's going to give me. So here we know that we're focused on the most likely diagnosis. And from looking at our answer choices, we really have a pretty good understanding that this is going to be a blunt abdominal trauma question. And if we're thinking about it from the beginning, we even realize that we've got a couple of conditions that would probably show up almost immediately, a couple conditions that might have more of a delayed presentation. So I know what I might be looking for in there. Now, if you'd like, you can pause this right here and take a look at the question on your own. Maybe think about what answer would be right, what answers you feel comfortable eliminating. So I'll give you a chance to do that, and then we'll hop back in with me running through it. All right, hope you had a chance to do that. So now what we can do is hop in here and really look at our key details. So we have a woman that was previously healthy coming into the emergency department because of abdominal pain. I do like highlighting gender in a question like that because we know that there are certain diagnoses that might, be ruled in or ruled out depending on that, or that could influence care to some degree. We see that the patient is a gymnastics coach, and 3 days ago, during practice, she fell and landed with her abdomen on the balance beam. She was seen in the hospital immediately following the injury and had a pretty normal workup and was discharged home. So if I'm being an active test taker, right there, I can go and get rid of hepatic laceration and splenic laceration because at least for the purpose of the test, those are not going to be things that really have a delayed presentation like that. That's something where at a bare minimum, there would have been some injury evident on that imaging that you did. So we kind of know already that C and D are gone. And even with esophageal perforation, I think we can get rid of that because this person is coming in 3 days later. You're not really going to go that long with an undiagnosed esophageal perforation. You would have been in much sooner, looking very toxic and having symptoms related to that. So moving back on through the question, we see that since coming home for the past 3 days, she's been having worsening abdominal pain and nausea. Today, there was some vomiting mixed in with that as well. We see that her last menstrual period was 2 weeks ago. It doesn't really matter if we've looked at the answers first because we know this isn't really factoring in management. This isn't really factoring in some of those GYN diagnoses, but that's okay. And we can get in here and start reading, and we see that, if we look through there, the patient's relatively stable. Abdominal exams show some bruising across the upper abdomen and tenderness to palpation in the same area with voluntary gardening. Doesn't really give me much between A and E yet. We're still really thinking about one answer there or the other. But what we do pick up on here is that the bedside ultrasound shows free fluid in the upper abdomen. So how could I get free fluid there? If this was a duodenal hematoma, I should not have free fluid. That fluid should really be contained within the duodenum. On the other hand, if this is a pancreatic injury, I absolutely could get that free fluid there. And that really fits what we're seeing, where with a lot of pancreatic injuries, because it is more of a retroperitoneal structure, it can have a little bit slower bleeding and more of a delayed presentation that fits here. So taking advantage of that timeline, the initial workup being negative, and the fact that we now have this free fluid picture as opposed to, the duodenal hematoma where I'd really be diagnosing that more on a CT, we know and we can feel confident that pancreatic injury is the right answer choice. So thank you guys for tuning in today. I hope this breakdown really helped you and looking forward to doing more of these with you in the future.